Your liver might be silently dying right now, and what I'm going to reveal today will not only shock you but also make you angry. Imagine that up to 90% of this vital organ can be destroyed before you feel any symptoms. This is exactly what happens to millions of people who ignore the early signs of liver disease, and I know what I'm talking about because I personally suffered from liver damage starting at age 20. Today, I'm going to reveal 7 alarming symptoms that nobody tells you about that could indicate your liver is in danger, as well as the true cause hiding behind this modern plague. Contrary to what you might think, alcohol is no longer the main culprit behind liver problems in our society. In reality, if we compare alcoholic fatty liver disease with non-alcoholic fatty liver disease, the alcohol-related damage represents only about 4% of cases, 12 times less than the other form, which affects more and more people each year. But before revealing the true cause, let's examine these early warning signals your body is sending you. The first symptom is a feeling of fullness, tension, or even pain under your right rib cage that can sometimes radiate to the right shoulder, down the arm, or be felt in the back near the shoulder blade. I didn't know what it was, but it was my liver swelling and putting pressure on the small tubes leading to my gallbladder. At the time, I thought I had a gallbladder problem, but it was indeed my liver that was causing the issue, since it controls the gallbladder, that small sac that stores and concentrates a fluid called bile produced by the liver to help digest fats. If you have a subscription, this is the perfect time to activate the notification bell so you don't miss any vital health information. And if you're not subscribed yet, join our community now to regularly receive advice that could literally save your life. This pain radiates to the right side through a small nerve called the phrenic nerve to the right side of the shoulder, creating a permanent tension that even massages cannot relieve. In my case, this constant tension on the right side eventually pulled the vertebrae of my neck to the right, pinching a nerve that went down my arm and causing all sorts of referred pain. I had no idea this was related to my liver and thought I had a cervical problem, but massages never improved the situation. There's nothing worse than treating the wrong problem, as it only perpetuates the true cause. The second sign is a loss of energy that may not manifest as flagrant fatigue, but rather as an inability to maintain your endurance over a long period. You might notice that you get out of breath more quickly during physical exercise, that you need to go to bed earlier because your endurance isn't what it used to be, or that you feel tired after eating. Your energy fluctuates instead of being stable and constant throughout the day. This fatigue can also turn into weakness, making you lose the vitality and strength you had before. I know people with liver problems for whom getting up from a chair is difficult, or who struggle to get up when sitting on the floor. The third symptom is a feeling of itching that can appear anywhere on the body, but often under the plant of the feet, or in extremities like the hands. For me, it was under the foot near the arch. These itches are caused by bile salts that flow back into your tissues when your liver isn't functioning properly. Curiously, people often notice these itches more at night than during the day, probably because movement and circulation help push these bile salts through the body. But if you stay in a fixed position for a while, you might feel more itching, particularly under the feet. The fourth sign manifests as small red spots or spider veins on the skin. This actually comes from higher levels of estrogen in the body. In men, this can translate to the development of additional breast tissue, while in women, it can lead to a whole series of problems related to estrogen dominance. Excess estrogen is not good for the body and can even lead to cancer. It's interesting to note that in aging men with liver damage, the skin becomes softer due to this increase in estrogen. Estrogen gives that characteristic soft layer of the female body. Furthermore, when you have more estrogens than androgens, you start to lose hair on your skin, which probably explains why older men start losing hair on the lower parts of their legs. The skin also becomes very soft and shiny, which is generally a sign of a liver problem and estrogen buildup. The fifth symptom concerns your thyroid, which depends on the liver for thyroid hormone activation. With a liver problem, you'll notice that your thyroid starts functioning less efficiently. This can manifest in many different symptoms, ranging from fatigue to hair loss, through decreased energy, higher cholesterol, or skin that becomes dry. This is specifically a reduced thyroid function caused by liver damage. The sixth sign is a vitamin D deficiency that worsens with liver damage. You might already have a vitamin D deficiency like most people, but with liver damage, the situation gets considerably worse. The reason is simple. When you consume vitamin D in foods, take it as a supplement or get it from the sun, it passes into the blood and then to the kidneys to become an active form of vitamin D3. What you need to know is that you need your liver to be able to function in this process of storing and using vitamin D. If the liver is not able to attach this protein to vitamin D, you will be deficient. The specific type of vitamin D that will be low is what's called 25-hydroxy vitamin D, the type that's measured in your blood. This is why some people take a lot of vitamin D, get more sun exposure, but still can't significantly increase their levels, simply because their liver is damaged. Among the symptoms that could appear with this deficiency, there's inflammation somewhere in your body, probably more in the lower back, but it can manifest anywhere. Your inflammatory markers will be much higher, your immune system will be weakened, and you'll have problems with calcium, which can result in muscle spasms, tight muscles, or muscle knots. Vitamin D is so important for the body that it influences 10% of all your genes, about 2,500 different genes. Its function goes well beyond simply regulating inflammation or calcium or muscle functioning. The seventh and final sign is that your urine will be a bit darker than it should be, and you'll also notice a strange smell when you urinate. This is a characteristic sign of a liver problem. Now let's dive into the true cause of a liver problem, because there's a lot of confusion about this. If you check Wikipedia, they'll tell you it's associated with this or that, and that you just need to focus on weight loss because obesity presents a higher incidence or is a risk factor. All this is very confusing, but I'm going to show you the true cause not only of fatty liver, but also of an inflamed liver that evolves towards cirrhosis, and this goes well beyond the alcohol-related cause. We're going to talk about the root cause not only of fatty liver, but of liver diseases in general. Obesity is associated with it, as is type 2 diabetes and what's called metabolic syndrome. So we're dealing with high blood sugar, high cholesterol, high blood pressure, and obesity, all responsible for non-alcoholic fatty liver disease. Of course, we have to make all this very scientific. High blood sugar will be called hyperglycemia or type 2 diabetes. High cholesterol will be hypercholesterolemia. Then we have high blood pressure, generally called essential hypertension. You are then prescribed medications like metformin for diabetes, Lipitor for cholesterol, lisinopril for high blood pressure, as well as a diuretic called hydrochlorothiazide that will thin your blood, and maybe even some opioids. All this treatment has been normalized for people. It's very scientific, it's normalized, and when it comes to causes, they always talk about association, risk factors. All these elements are the reason why you're being treated. In other words, we have sugar, starch which is sugar, and seed oil. These three ingredients are the root cause. And even more at the root are those actors who finance dietitians and maintain a very close relationship with the FDA. Recently, I interviewed an influencer on TikTok and Instagram, an extraordinary basketball player who is only 22 years old. I wanted to interview him to see if I could change his diet and improve his performance. It turns out he eats at fast food places like McDonald's, has pancakes with syrup for breakfast, basically a lot of junk food. I asked him if he had any health problems, and he told me he was a bit tired and wasn't sleeping well at night. I told him we were going to change that and made recommendations. That's when he revealed to me that he had high cholesterol, and that his doctor wanted to prescribe statins to lower it. He's 22 years old, 22! The doctor made this slight omission regarding his diet. Why not change the diet? I think many young people, because they're not overweight, think they can afford to eat junk food, but it causes many other problems. If a 22-year-old takes statins, they will first suffer a lot of muscle damage, not to mention energy, and eventually cognitive functions, and even testosterone, because the basic material of testosterone is cholesterol, and what they do with this medication is block it. What's really happening is that they're omitting this huge cause. The food industry is responsible, but this has been normalized, hidden. You are an ATM for the food industry and the pharmaceutical industry. I'm considered a quack because I recommend something like the keto diet, which essentially consists of reducing the consumption of sugar, starches, and seed oils. They will sow doubt in people's minds by saying, oh, the keto diet may work initially for weight loss, but we don't know the long-term effects. It's such a disinformation campaign, but the keto diet is the way to go. The junk food industry doesn't like the keto diet, which is why you sometimes hear negative things about it. And sometimes I hear, Dr. Berg is not a real doctor, implying a doctor who prescribes scientific medications, who makes the right diagnosis, who applies the right treatment according to standards of care, and puts people on medications. I don't want to do that. I never wanted to do that. So they can call me a quack all they want. I'll continue to tell people to eliminate these three ingredients. And what will happen is that you will reverse many of these symptoms and eventually this disease. Now that I've told you what not to eat, the next question is, what should I eat? And for that information, you should watch my next video.